We're back at Hairfax again, once again, to talk to Larry. Today we're going to talk about non-surgical treatments and ask Larry some questions about what the different types are, what we should be looking for, and all of those questions that we might have. If there's a question that's not answered here today with Larry, make sure you drop it in a comment, email us, whatever you need to do, and we'll make sure you get the answer.
When you can actually show people what you're seeing and they see it, then they can understand the direction that you're headed. Non-surgical treatments involve a lot of different things. It can be, things like Rogaine, Propecia, ProScar, Avodart. These are all things that people can do to help try to retain what hair they do have. But basically, people are funny because when they don't see results, they quickly abandon the treatment, and that happens all the time. Most people that I talk to have tried all this stuff. They've tried the Rogaines, and don't like the way it makes their hair feel or their scalp feel, or they get tired of doing it. Similarly speaking with medications, they maybe take it for a year or two, maybe they forget to take it a lot of the time. Again, they don't see the results that they want, so they quickly abandon the treatment, and that happens all the time. The idea with this type of stuff is to try to retain what hair you do have. And most people are, once they've walked down that road and they see that they're maybe retaining some hair, they never truly realize that. They just think it should be thicker or there should be a difference. And it usually doesn't deliver on that. Non-surgical solutions treatment can be very quick, so you would have the results very, very quickly, unlike anything that's done surgical. A surgical option really takes sometimes up to 2 years to see the full result. So it's something that's very gradual. So comparatively speaking, if you went on something non-surgical, we can do it in a gradual approach if that's the way the person wants to do it. In other words, they don't want to go with a full head of hair all at once. We can start it out and do it on a step-by-step thing. It really depends on the individual, and that's why this consultation is so important, to determine what their expectations are and how they want to proceed. So side effects to non-surgical treatments can be side effects like blood pressure issues, if you're using different types of topical solutions, to lower libido if you're ingesting different types of medications orally. If you're doing something in regards to a hair system, well, that's there's not really side effects to that. There's just issues where you may need to come for maintenance more often, possibly. Non-surgical treatments, hair loss solutions are not permanent. What I mean by that is the hair is attached to your scalp, but of course your scalp sweats and there's oils and things like that, so it does need to be maintained, and that's why servicing is so important. So we offer 4 different locations to try to address those logistics, I guess, and getting clients to get in for maintenance on a regular basis. And that's very, very important. To choose the right treatment option for your hair loss is very, very important that we sit and talk about it, because I see so many people that are, order stuff online or without ever talking to anybody or even discussing what their expectations are. I think that's where it becomes very challenging, when you see people that are hopping a plane and flying to Turkey without actually sitting down with somebody and discussing the process and what the expectations are and so on. I find that I guess where I've been in the business for so long, I can't even imagine doing that without having a face-to-face conversation. I think it's really important to to discuss all the ins and outs of each procedure, and together we'll find a solution that works best for them and basically deliver on the result that they want. I just wanted to invite everybody to come in. If you have any questions about hair loss or you want to talk to somebody about it, certainly I'd be more than willing to sit down with you and have a conversation and help you out.